The macro trends in healthcare and the associated career opportunities in 2020. University of Maryland University College. CAD 600,9043, summer semester. Macro trends affecting the U.S. healthcare system. Demographics. Lifestyle and behavior. Technological advancement. Government policies and legislation. Economy, demographics. One trend that will have an impact on healthcare practices is the ever-changing demographics within the United States. Projections by analysts suggest that the number of aging individuals will double in the next few decades, which implies that there will be higher consumption of health services and more demand for geriatric care. Barrick, Nolan, and Whittington, 2008. A University of Kansas study estimates by the year 2020 that over 20% of the U.S. population will be 65 years and older, with people over the age of 85 being the fastest growing age group. Husung, 2016. The rapid changes to our demographics in our country will demand changes to the way we deliver healthcare. Healthcare providers will encounter new challenges with our aging population because with age comes an increase in chronic diseases along with more complex conditions, lifestyles and behaviors. Another growing trend in the U.S. is the change in lifestyles and habits, with people consuming more junk and exercising less due to their occupations, and the rise in habits like smoking and alcohol use. The impact of these changes is already evident in the increased cases of obesity that have necessitated a worldwide campaign by various pressure groups. Doak et al., 2012. The rise in chronic diseases is also due to the changing lifestyles that have included feeding habits that are unhealthy and constitute risk factors for diseases such as cancer, diabetes, and high blood pressure. Technological advancement. Another macro trend impacting healthcare is the high technological advancement that is employed in various health processes. Many parts of the healthcare industry have already experienced the benefits of technological advances and better medicine, including better and faster diagnostics, continued advances in drug design, rapid developments in gene sequencing, and the exploitation of bioinformatics, large datasets, and computation analytics. Each new digital innovation requires massive investments, training, and organizational change. Healthcare IT Trends, 2015. Nonetheless, the digital revolution is pushing and pulling the entire health industry. Digital technologies transform the healthcare in three fundamental ways: 1. At the health consumer level, 2. At the enterprise level, and 3. At the industry level. At the consumer level, technology has significantly changed the vision and modality of patient treatments. Technological advancement. Cybermedicine is the future of medicine. With the use of smartphones, tablets, laptops, and webcams, many individuals are turning toward cybermedicine as a way to visit their doctor. Hospitals all over the country have some sort of cybermedicine. MedStar Health has on-site doctors to provide care for certain areas, but they also have off-site physicians ready for consultations at the click of a button. For example, MedStar St. Mary's Hospital, a rural community hospital, has the ability to link with MedStar Washington Hospital Center's neurosurgeon if the need arises via a webcam and display monitor. The ability to have the patient in front of them and communicate with them has allowed patients for access to high-quality care when traveling is not an option. The neurosurgeon can consult with the patient, prescribe medications, and make recommendations. Because of this trend, informatics-based careers have skyrocketed. In fact, many college universities are offering coursework specific to healthcare informatics. This trend in cybermedicine will affect personal lifestyles and behaviors in a variety of ways. Individuals will have access to treatment and consultations easier than ever. This should improve people's way of life because the days of waiting for an appointment or commuting over an hour to reach a doctor's office will be over. Convenience is a benefit for cybermedicine as well. By 2025, IT careers will be a booming business due to the rapidly changing communication and networking within many healthcare organizations, government policies and legislation. Mutant government policies and legislation in the healthcare sector also have proved to be a significant external force affecting the shape of that healthcare industry over time. Every government comes up with new and significantly radical policies and initiatives that not only define practice but also require careful consideration due to the implications of non-compliance. Shi and Singh, 2014. The Affordable Care Act, which made it mandatory for all citizens to acquire medical insurance, is an example of such policies, government policies and legislation. A peace of mind is what is needed when the future of healthcare is moving from using paper to electronic medical records. In 2009, President Obama signed the American Recovery and Reinvestment Act, which encouraged but not limited to the benefits of using electronic medical records such as reduction in paperwork, improved coding and billing, greater coordination in care, and legible records, program integrity, Documentation Matters Toolkit Centers for Medicare and Medicaid Service, ND, P20. Government policies and legislation, MACRA and Merit-Based Incentive Payment System. The Medicare Access and CHIP Reauthorization Act of 2015, also well known as MACRA, is trying to monitor the healthcare provider closely in order to ensure quality of care and make sure the Medicare physicians payment system is being used properly. This means that CMS is making sure federal and state beneficiaries are being well treated. The MIPS or Merit-Based Incentive Payment System will measure four categories. App, 2017. Quality, CMS will use Physician Quality Reporting System, PQRS, criteria. Cost, Medicare will use the Valued-Based Payment Modifier criteria. Advancing Care Information, Electronic Health Record, EHR, incentive program will be used. Improvement activities. This category contains a series of activities that some clinicians must report as part of the patient's plan of treatment, government policies and legislation. To ensure to benefit from the change from paper to electronic records, medical facilities will need to invest in IT consultants, which may result in excess administrative cost. One study that was in a teaching hospital shows that having a professional team of IT consultants on staff to educate the medical staff how to operate electronic medical records software, readiness of Shiraz teaching hospitals to implement electronic medical record, EMR, directory of open access journals, ND. The study concluded that teaching troubleshooting and to set up protocols for employee security access pays off, which will decrease any fraud or breach into the software. The society today is growing in technology and will capitalize on developing electronic software. It may be wise to predict that in the future everything will be paperless. As a result, excess administration cost will be spent on creating the best software for the medical facility to prove patients' lifestyle. Economy. One of the macro trends affecting the U.S. healthcare system is the economy. The cost of delivering healthcare is rising while reimbursement is declining. Healthcare systems face increasing financial difficulties because of the federal sequester, which created a 2% decline in Medicare reimbursements, the Balanced Budget Act of 1997, and Managed Care, PUNC, 2013. The Centers for Medicare and Medicaid Services, CMS, cover 41% of patients receiving inpatient hospital care, Dunn and Becker, 2013. The Hospital Inpatient Prospective Payment System, IPPS, regulates payments received from CMS. This system establishes the method of payment calculation for all inpatient Medicare services provided. The calculation includes three components: coding, coverage, and payment. Understanding Medicare reimbursement under the Inpatient Prospective Payment System, 2003, Job Opportunity, Medical Reviewer. Since the Center for Medicaid and Medicare, CMS, has released a new system of reimbursement based on the quality of care, healthcare providers require an expert who is able to identify if the medical records, billing, coding are compliant with the medical necessity in order to avoid penalties and less reimbursement. Medical reviewer are the ones who monitor and examines the information, so the healthcare providers would be qualified better into CMS system. The accuracy of the data is very important, so the candidate should prove experience, and most of the time companies require a certified professional medical auditor certification. According to Glassdoor.com, a medical reviewer salary is between $55K to $60K annually. Conclusion: healthcare constitutes one of the most dynamic sectors of the economy in the U.S. There are internal and external changes that define practice, norms and policies in the healthcare sector such that the future can only promise more unpredictability. Macro trends are patterns of events outside the healthcare industry that impact on the shape of healthcare institutions and define their changing landscape. These macro trends include the economy, changing lifestyles and habits, demographics, technology and the ever-changing government policy. These factors premise the emergence of policy analysts, health IT analysts, population health managers, community health managers and health economists as popular careers by the year 2020.